Good afternoon. My name's Adrian Wilkins, and I'm with Wilkins Honda Mello Associates. I'm a dental consultant and practice management consultant, and I'm here today with Linda Mello from WHM Consulting as well. So welcome to our webinar this afternoon, and good afternoon, Linda.
Hi, it's really good to be here, and I'm excited to share our insights about hygiene cancellations. I'm ready to get going when you are.
Okay, great. So as you can see, for those of you who have signed up for our webinar today, the title of our webinar is Why Hygiene Cancellations Could Be a Blessing in Disguise. And I'm sure that when people read that, or at least some people read that, they probably said to themselves, what is he talking about? What are they talking about? How could that possibly be true? And yet, we really do believe that. As I said before, I've been a practice management consultant for about the last 15 years, and Linda has been doing this, Linda, for what, 25 years or more?
25 years.
And on top of that, Linda, in addition to being a consultant for the last 20 years or so, is also a registered dental hygienist, so she really knows what this is like to be in that.
This is pretty personal to me, so yeah. I really hope to help you get a sense of this that might be a little bit different than you've heard before.
Yeah, and today probably will be a little different than what you typically hear when it comes to dealing with this really important issue. So why don't we get started? And by the way, for the purposes of this webinar, you have the ability to ask questions, make comments, simply go into the chat box and let us know. We'll really do our best during the webinar to answer questions that come up, but if we're not able to answer those questions, we are keeping track of them, and we will get back to you to try to answer your questions. But we really invite your participation to the extent that it makes sense during this. So we picked this subject because as dental consultants, I hear more and more from people that they're seeing last-minute no-shows and cancellations happening in their practices all across the country. In fact, I would say it's happening now in epidemic proportions. I don't think there is a week that goes by that I don't get a phone call from somebody saying, my hygiene schedule blew out at the last minute, it's full 6 months in advance, it's full a month out, and then either the day before or the morning of or the patient no-shows. And it's really become a problem, and I suppose it's always been an issue, but it seems to me that we hear it more and more. And clearly, it's a problem in terms of production, morale, the patient care. All of these things are, a serious issue with cancellations. Why? We can only speculate. Some of the things that I believe, or we believe to be true, is that people have less free time probably than they ever have before. Many people, many families working 2 jobs, trying to keep up with their lives has become much more difficult, especially in this, what most people would describe as a challenging economy. Even Linda pointed out earlier when we were talking about this that for a lot of people, there are people that are telling us they're even afraid to go to the dentist because they can't take the time off from work. So more and more you see people prioritizing something else in front of their hygiene appointment. What's the typical approach to preventing hygiene cancellations? And I'm certainly interested, again, for those of you just joining us, feel free to jump in, ask questions, make comments. But these are the things that I hear from offices when I talk to them in terms of what they're doing about this issue. One of the major things is to send multiple card reminders. So maybe a month out they're sending a reminder card. Some people get creative and personalize the card, have the patient fill out the card and send that, and so the patient is receiving their own reminder card. Some people are using an electronic system that sends a paper reminder card, multiple email reminders, multiple text messages, multiple phone calls. And when all of those things don't seem to work, the thing that I hear is that people charge for those missed appointments. And if there are other things that you're doing, I'd be interested in hearing those also. But for the most part, these are the approaches that we see most practices take. And the question is it working? Is this solving the problem? And based on the interest we're seeing in this webinar, I would say the answer is no. I think what we hear is that those things work some of the time, but don't work all of the time, and then oftentimes they're actually counterproductive. And maybe we should start there by talking about some of the reasons those things don't work or don't work as well. First of all, not everyone is the same. I'm just realizing you guys aren't seeing these slides, so hopefully you can see those slides now. Not everyone is the same. Some people need to be reminded over and over, but for some people it really turns them off. And in the work that we do with clients, we do a lot of work in terms of understanding who clients are specifically. And for those of you that are familiar with different personality typing systems, that kind of thing, whether you're using Myers-Briggs or the DISC system or other systems, you may be familiar with styles of people. So for example, if you get a person that's maybe what we would call in one system a promoter, somebody that's kind of that cheerleader person, they're that big picture person, but they don't do so well with the details, that person might really benefit from getting those multiple reminders. And in fact, they might even appreciate it.
And they might even ask for them, right? That might be an agreement you make in helping people to keep their appointment, is that you send lots of reminders.
Absolutely. And what we're talking about here is where it's done sort of across the board as a blanket policy. And then on the other hand, you may have another person, someone like myself. I like to believe that I'm the kind of person that keeps my appointments, for the most part, is on time. I rarely need a reminder. I take being places on time very seriously. You can imagine how I would respond to receiving multiple emails, multiple cards, multiple reminders. For me, it's an annoyance and, frankly, at some level, even insulting. And that's one of the problems that you see often with a lot of cookie-cutter approaches to solving problems like hygiene cancellations. The same thing doesn't work in every practice and doesn't work the same for every patient.
So Adrian, if I were to send you lots of reminders, would you have the sense that maybe I didn't trust you?
I would say to myself, what is it with these people? How come I keep getting these calls? Do they think that I'm not capable of handling my life?
Right.
It wouldn't be paying attention to me and who I am. The other problem that we see with repeated calls and reminders is it really communicates a sense of scarcity and desperation to the patient. In fact, even pushes them away. If you think about it, what's the message that a patient gets when they get all of those reminders? They're saying to themselves, why do they want me in there so badly? And I have to believe that patients start to question, who is this appointment for? Is this for the benefit of me as the patient? Or if I'm getting all these reminders, is it for the benefit of the practice? And what will a patient feel when that's happening? So although the intention is good to do all these reminders, the thing to keep in mind is in some cases it makes a lot of sense, in other cases it doesn't. And that makes it a little bit more complicated, because in practices what we tend to want to do is come up with a system that works for everyone. And as you'll see as we continue to explore this, that's unlikely to really work. And it's a lot simpler just to put a policy in place and say this is what we do with all patients. And yet, since people are not the same, some people that's going to benefit and some people that's going to actually drive away. And finally, when patients don't come in for their appointments, I think what happens is we get a little frustrated. We take it maybe a little personally. We get to the point where we say they're not listening, so we've got to solve this something, and we resort to charging people. And although I hear from offices they charge, when I dig in a little bit deeper and we ask them, okay, how many of those patients actually pay those charges? And the reality is not that many. And the ones who do are now upset with the practice. So they didn't value the appointment to begin with. That's why they didn't come. That's why they didn't show up. And now they've been charged for that appointment. So what's the likelihood that we're going to keep that patient? And what's the likelihood that they're going to be committed to their appointments in the future?
And usually the fee that's charged isn't really, doesn't support the fee that you would have charged originally for treatment or hygiene visits. It's kind of a nominal fee and just says enough that we're upset with you.
Right. So we clearly communicate, you're bad, we're upset with you, but do we really accomplish what we're trying to accomplish? And I'd be interested, again, there are more people keep jumping on, and that's wonderful. Feel free to make comments or ask questions. But if you've had a different experience, I'd be interested in hearing that. However, what I have seen from working with many practices is that rarely turns a patient around. Okay. So what is the issue? And I guess what we would like you to hear is that we see hygiene cancellations as a symptom, not the disease. Yes, in and of itself, it's a problem. In and of itself, it costs you revenue. In and of itself, it's a frustration. But more than that, it really is a symptom of a much deeper problem. And that problem has some components. A lack of value for the appointment. I realize that's obvious. You didn't need us to tell you that. But really hear that. The patient is telling you that something was more important than that particular appointment that they had with you at 2 o'clock or at 1 o'clock on Wednesday afternoon. You know, we have tons of people sign up today for this webinar, and the ones that are not on the webinar with us right now that signed up, something came up that was more important to them than this right now. That's the feedback. That's the message. And the same thing is true with your patients, that if they're not coming to that appointment, whether it be a hygiene appointment or an appointment with the dentist, they're communicating something to you.
I think it's important to recognize, Adrian, and all of you, that sometimes that cancellation appointment, it seems like at that moment there was something else that came up that they valued more. And if you were really to do some thoughtful thinking in your practice, you would probably get a sense that people didn't value the appointment even when they were scheduling.
Right. That's a good
so for some people, they'll say that, you know, the hygienist wanted it more than they did. You know, right away, they look at that day sheet, they already know who's going to cancel.
Right. Yeah, it's a very good point, Linda. It doesn't happen at the last minute. The other thing that's being communicated clearly is a lack of value for the dentist in the office, because every time a patient cancels, at some level, they're putting their opportunity to come to you at risk. They're telling you, hey, I know if I don't come, there's a chance that if I don't come, or if I don't come more than once, that I'll lose the opportunity to come to you as a patient. And yet, they're still making that choice. So they're really telling us that the value for the dentist in the office is not as great as something else. And finally, it's an indication of a lack of relationship with the patient. And we're going to talk a lot more about relationship, because we think this is critical to reducing and eliminating, to the extent that it's possible, these last-minute cancellations. So don't shoot the messenger. And I know this is a tough one. There's a huge frustration when it happens. It's easy to become judgmental. It's easy to say that people are irresponsible. They don't care. They don't do what they should do. We can go into our stories. We can even take it to the point where we say they're hurting us or they're hurting me. And we can really get pretty frustrated with people, both in terms of how we talk to them and then how we handle them. But here's the thing. Bottom line, whether you believe anything else that you hear us say today, accept the reality here. It's like gravity. You know, you drop something, you know it's going to fall. It's a law of nature. Well, here people are giving you feedback. They're telling you in the clearest terms possible how they feel about you in those areas that we talked about before. They're telling you how they felt about the value of the appointment, the value of your practice, and what kind of relationship they have with you. The first step is actually to stop and say, great, at least I know what's going on. In a certain way, it's actually worse for that patient to come in, go through the hygiene appointment, not really value the treatment, not really care about what they're doing, but to continue to show up just so they don't upset you or upset the hygienist. And they maintain sort of like a friendliness with you. And the whole time they're not valuing that hygiene appointment, and they're not valuing the practice, and you think they are because they're coming in. At least these people are telling you very directly that we don't appreciate, or we don't value, I shouldn't say appreciate, we don't fully value this appointment. And they're telling you that something else was more important to them than this. So
and they're telling you really in the only way they know how.
Right.
That we can't expect our patients to be the best communicators. That I know in dentistry we struggle enough with that ourselves. And so they're telling us, but they're telling us in the best way they know how.
That's a great point, Linda. And in fact, there's a terrific book out there. It's called How to Win Customers and Keep Them for a Lifetime. And there's a tagline in the book, or a chapter in the book, that's entitled Good Customers, or Nice Customers Are Ruining Your Business. Because your nice patients don't cancel, but they don't really tell you what their experience is. And these are the people giving you the feedback. So I won't beat it to death here, but really hear that this is information if you allow it to be information, and it can be very powerful. So how do you convey value for a hygiene appointment or any dental appointment? Charging and punishing doesn't work. Educating patients about the value of their appointment helps. But in order to educate your patients, you need to create a desire for that knowledge. And I think this is important because the first thing we do is say, educate them, educate them, educate them. You go to dental school and everybody's telling you that the key to working with patients is patient education. Your job is to educate them. And certainly that's true. And if your patients really understood the value of their appointment, I believe many of them would come. But the reality is that you can't educate anybody about anything until they tell you that they want to know. You know, the example I like to use is that if you've ever sat on a runway at an airport and you're getting ready to take off, and the pilot comes on and tells you the flight attendants are going to go over the safety information. And if you watch them do that, they're up there giving their speech much the same way we give patients their speech. And they're explaining how to use, what to do in the case of an emergency, and people are checking their cell phones and, you know, reading a book or talking to each other or glancing up occasionally. And some of that is because, you know, they think they know already. And it's, you know, in that moment, they're not really interested in that information. On the other hand, if you're at 30,000 feet and the pilot comes on and he says to you, you know something, we're having some engine trouble, no big deal, we're going to go back to the airport, but we're going to make an emergency landing, and I'm going to have the flight attendants come out right now and go over the safety instructions with you. Now imagine the way that you would listen to that knowledge and information that they want to convey to you. I got to tell you, you would know exactly where that seat cushion is. You'd know exactly what to do with everything, how to tighten your seatbelt, and you'd know exactly where the exits are because you're at the point where you are interested in that information. You are interested in being, quote unquote, educated. So
and it's not to say that people have to be at a level of emergency to hear you, but an engagement, a level of engagement where people are wanting information is really critical.
Yeah, and of course I'm giving you an extreme here, But you can get the idea that, wait a second, when do we listen? We listen when we're interested in knowing. And how do we create that interest in knowing? How do we create that with our patients so that we can educate them about the value of their appointment and consequently have them decide to come in? And then the other thing that I see happening in practices a lot is taking that patient who cancels at 2 o'clock this afternoon and saying, oh, I have an opening at 4. Can you come then? Oh, no, you can't come at 4? How about tomorrow morning at 7? All right, you can't come then? How about at 11? What's the message that we're giving to patients? We're saying to that patient, you know, there's no value to this appointment. You can have that appointment anytime you want, day or night. And although it's tempting when we get to that point of wanting to fill our schedules to do that, you really want to think about that. And as we said in one of the announcements, this webinar is not about the 3 quick tips to filling your hygiene schedule or to keeping it full. It's really looking at the core issues and how to change that. However, if you do want one simple tip, I would tell you to avoid putting those patients right back in the schedule. However, it needs to come from that place of within yourself of saying, hey, these appointments are valuable and they're not available immediately. That's the way that it's the most effective.
And if that patient is really telling us that they're not valuing the treatment, then what has changed from 8 o'clock to 2 o'clock?
Right. If at 8 o'clock that wasn't a valuable appointment, it doesn't all of a sudden become a valuable appointment at 2 o'clock. And what's the outcome of that appointment going to be when that patient comes in? So what are some of the things that cause a patient to value your practice and their appointment? And a lot of the ones that we hear from people, or maybe not hear from them, but the things that our clients tend to focus on when we first work with them or before working with us, the things they tend to focus on are things like, do they have a good location? Do they have systems in place for educating patients, whether it's Casey or photography or anything else? Do they have a beautiful facility? If I have a beautiful facility and I have marble floors and it's gorgeous and I have hot towels and so forth, that's going to have my patients value my practice. Is my staff friendly? Do they get along with everybody? Does everybody like them? Those are things that we tend to find people use to try to create value. Participating in insurance plans. If I take every insurance plan under the sun, these patients will value me more and come to me. And when all else fails in business, one of the things that we see people do is lower their prices. By lowering their prices, they're going to be more valuable. And really, I would say to you that all of those things, location, education, facility, friendliness, insurance, price, these are the price of admission, but will not by themselves cause patients to value your practice or their hygiene appointment. So when I say the price of admission, in this day and age, you better have a good location. You'd better be good at educating your patients. You'd better have a great facility. You cannot afford to have an unfriendly staff. Insurance and price we can talk about, but these are certainly, if you charge way more than everybody around you, that'll be challenging. Okay.
So it's a cost of doing business, but it doesn't necessarily set you apart.
Yeah, and in fact, it can't set you apart. Just think about it. How much better a location can you have than the next guy? How much better patient education can you really do? How much better of a facility can you really have? Yeah, you can be friendly. How much more friendly can you be than the person next to you? So these are really the price of admission. So what does cause a patient to value your practice and their appointment? And what I would say to you, or we would say to you, is who you are and the patient's relationship with you and your team. So some of you now are sitting there saying, I got on a webinar to hear about patient relationships. Do they think I'm stupid? I know you know this. or I believe you probably already know this. However, the way we're talking about it, we're really talking about it in a way that you may not have heard before, or heard quite the way we're going to talk about it today. But start by considering the possibility that who you are and the patient's relationship with you and your team is really the thing that causes your patients to value their appointment or causes you to be in a position to convey the value to your patients.
So there's value in the relationship and there's value in what you've created together.
That's correct, Linda. So what we're saying is the relationship in and of itself, if I really feel connected to you, if I really feel like that in relationship is important to me, that in and of itself creates value. And if I have that relationship with you, I'm then able to convey the value, the clinical value or the health value of the appointments in dentistry that you receive in that office. So this brings us to a concept that we talk about. We run workshops on it. We work with practices on it, something that we have coined as relationship-centered dentistry. And I'd like to start by talking about what relationship is not, or what relationship-centered dentistry is not. Relationship-centered dentistry is not, how are your kids? It's not, what did you do this weekend? It's not, where are you going on vacation? It's not the patient walking through the front door and hugging your front desk person. There's nothing wrong with any of those things. They're great ways to build rapport. It's wonderful that you care about them, they care about you, they like you, you like them. But in the levels of relationship that we're talking about, it's very close to the surface in comparison to what we have found is possible in a dental practice.
So Adrian, earlier we talked about a conversation about a restaurant might be useful in learning about that person a little bit if we uncover more about why they went to that restaurant. If we stay on the level of where do you like to eat, this is where I like to eat, this is where you like to eat, and it's just a banter back and forth, might not be helpful in terms of our relationship until you really get a sense of, I go to the restaurant because these are the kinds of foods that I like to eat, or I go to the restaurant because they have a menu that works for me and my family. That it starts to go just a little bit deeper in helping me to identify what's important to that person.
Right, absolutely, Linda. So the information itself becomes not just, oh, I know this about your kids, but what is it that it means that this person is so committed to their kids, or that that's the most important thing in their life? How does that then affect their decisions when it comes to the dentistry for their family and for themselves? So we learn about a patient's values when we really connect with them. Some of the benefits of relationship-centered dentistry, because obviously this is what we're saying to you is the solution to your cancellations, one of the benefits is simply that patients value their dentistry. If I'm really connected to you and I really understand you and you really let me in, I can talk to you about why it matters, and you can really hear it, or I can hear it from you. In a relationship-centered practice, money and insurance are important, but they don't dictate treatment. It's not that all of a sudden patients don't care about money anymore if they have a relationship with you, but it stops being at the top of the list. It becomes one of the things that they pay attention to. In practices that really get this and own it and are able to live it, they experience exceptional patient loyalty in both directions, loyalty to the practice and loyalty to the patient, where patients would not consider going anywhere else, that it doesn't matter to them within certain parameters what you charge or what insurances you take, because they really feel connected to the practice, because they feel understood, and they feel as though they understand the value of what you do specifically for them.
And creating a treatment plan, right? Creating a treatment plan together helps that patient really identify where they're going. So they're not only loyal to the practice and to the providers, they're loyal to the work that you've created together.
Absolutely. In these kinds of practices, you'll find that they tend to have higher production and collections than what you see in other practices. They tend to have lower costs, and we can talk about some of the reasons for this, or I'm happy to entertain questions about that or talk to anybody that wants to talk about it at another point in time. But they tend to be very profitable because the production and collections are high, the write-offs are low, and the overhead tends to be much lower in a relationship-centered practice. One of the other benefits is lower hygiene and dental cancellations because the patients really do value what they're receiving. They understand why they're coming. They want to come. They're not coming because they're supposed to come every 6 months. They come because it's in their best interest. They understand why, and the experience and the relationship they have when they come to the practice is a very important thing to them. And finally, and I think one of the most important ones, is the patient ends up getting better care, because what kind of care does a patient really get if they're just coming in because they have to or because they think they're supposed to? So it's better care for the patient and personal fulfillment for the dental team and the dentist. I mean, it's a wonderful experience, and people tell me this all the time, that it's amazing when their patients are coming in because they really want to come in. They don't hear those, "I hate coming to the dentist." They may start there, but eventually they come around to, "This is one of my favorite places." And it isn't because they're super sweet or people are super friendly. It's got more to do with the connection that's been created. So,
and I have to say, Adrian, that that relationship-centered dentistry is not for the elitists. It's not for like a certain percentage of dentists that think they have to be this certain way or set apart. It really is something that's learnable, that people can do this. People can step into a way of being in relationship very different than they ever have before and see huge changes in their practice.
Yeah, I think that is important. This is not about, that's a good point. This is not about a boutique practice. You know, certainly to generate the kind of results that some people want to create, it's critical to have this. But in every practice, patients benefit and the practice itself benefits. And it's absolutely doable. And as you're saying, Linda, it's not even an all or nothing. It doesn't mean everybody's on a continuum. Some people get these principles and concepts and they get a lot out of it, and other people get a tremendous amount out of it, but everybody creates value.
And we've seen practices become very successful even when the doctor only steps into relationship-centered dentistry. At some point they may say, I need to be surrounded by a healthy team to help, you know, make this happen more fully. But we've seen even when the dentist shifts their ownership to relationship, things change dramatically.
And ultimately, once the dentist does, the team does also, because they get it. It makes sense. They see it. You know, one of the things I'd like to say, and it sort of lends itself to what you were talking about, Linda, is that this is not complicated. It's relatively simple. It's not the kind of thing that there's tons of scripts. You have to learn lots and lots of information. You need to know how to overcome objections or anything like that. It really is about creating a very deep connection and relationship with your patients. Now, when I say it's simple, that doesn't necessarily mean it's easy. You know, the analogy I would use is we might all know that it's really important and the right thing to do is to not lose our temper when our kids are aggravating us. That's a simple concept. We may not find it easy to do. And the same is true with relationship-centered dentistry. The concepts are very simple. However, doing it requires a real commitment to our own personal growth and our own effectiveness. It is an incredibly effective way to practice. And as I said before, it does require a commitment to your personal excellence in terms of your ability to relate and communicate. And one of the reasons I love working with dentists, because for those of you who don't know, I am not a dentist, but I've been working with dentists now for quite some time, is I'm really, I don't know, touched by the fact how hard most of the dentists I know work to be great at what they do clinically. I mean, it's not unusual for me to see dentists spend hundreds of hours on continuing education. They really, really work hard at becoming the best at what they do and constantly gain knowledge. And that is that commitment to personal excellence that I'm talking about. For those of you that are on this webinar right now, you took an hour out of your day to get better at what you do. That's the same thing that we're talking about here. It's a skill set. It's an ability, a skill set, a way of working that does take attention on your part to become very good at it. But you can absolutely do it. And the results are extraordinary. I mean, I have a little difficulty sometimes when it comes to talking about this, because when I say some of the things that I say about this, to some people it sounds too good to be true. I see practices that have really embraced this that don't have hygiene cancellations. They're very rare. And when they do have a hygiene cancellation, they're not frustrated by it. They're really puzzled by it. Like, I wonder what happened to Adrian, or I wonder what happened to Mrs. Smith, or I wonder what happened to Linda. I'm genuinely concerned because it's not like that patient not to come. Imagine what it would be like in your practice if when you heard there was a cancellation, you said to yourself, wow, I wonder if they're okay. I wonder what's going on for them, that it was that rare. What would it be like in your practice if your patients were asking you for dentistry? We just did a workshop, part of a 18-month program. We just were part of a workshop the other day, and the hotel staff was nice enough to volunteer themselves for some role playing, but they were real. I mean, these were legitimate people that didn't know what we were going to ask them or talk to them about. And within a few minutes, without any manipulation, coercion, or anything else, we had 25 and 27-year-old potential patients sitting there telling us that even though their insurance wouldn't cover it, and even though money was really a challenge for them, they would want inlays and onlays instead of composites and amalgams. And I know that may sound hard to believe, but it was clear as a bell. And it didn't come from any convincing or anything else. They came to that conclusion out of the relationship that was created with them. So,
and not only did they want that, Adrian, but they were surprised that it wasn't suggested to them before.
And yet,
like it was,
right.
There was a way that they were sort of disappointed that people didn't offer them the kind of comprehensive care that they really ultimately wanted.
And yet, within the first 3 or 4 minutes of speaking with them, they told us the first things they said were things like, well, price is important to me. I don't have a lot of money. I'll do work based on what my insurance covers. And they weren't lying. That's exactly how it felt to them. That's what it meant to them. So what would it be like to have a practice full of patients that came to their appointments, and in addition to coming to their appointments, were excited about what you had to offer and were interested in the dentistry that was available to them? That's the power and the possibility in relationship-centered dentistry. And that doesn't mean you go to one of our courses and the next day you're there. But you do really see a difference, and you see that difference occur very, very quickly. Some of the pieces, again, in a 1-hour webinar, we can touch on some of these things, but some of the pieces that are critical to a relationship-centered practice are things like time. In dental practices, to really have a relationship with patients, time becomes critical. And that is usually a concern when people first hear that, because what are you taught? Productivity, productivity, productivity. But what you find is that the benefit to giving the time is productivity way beyond what you initially thought was possible. Listening. Listening, I almost hesitate when I put this on the slide, because I say everybody thinks they know what listening is, and we all do. But we're talking about a kind of listening that's different than what happens most of the time in most offices, especially when we limit the amount of time that we make available for listening. I mean, there's so much effort put into maximizing productivity, clinical productivity. It makes it difficult to have the time, and it makes it difficult to listen on the level that we're really talking about here. Authenticity. Again, not a complicated concept, but this is where we believe the cookie-cutter approaches to scripts, although scripts can be valuable and have a place in a dental practice, you can't say the same thing to every person. You know what it feels like when you're standing in the grocery line and somebody looks at you and says, "Have a nice day." In fact, there was a great book that I read. Someone had opened up a store next to a Nordstrom's, and this consultant went into this new store instead of Nordstrom's, and they bought something, and it was just a normal exchange. And when they got to the end of the exchange, they put the receipt in the bag, and the person headed for the front door. And when they got to the front door, the clerk yelled across, "Hey, you!" And the person, feeling a little bit embarrassed, went back and said, well, what's the matter? And she reached in, she took the receipt out, she put a little smiley face on the receipt and wrote, "Thank you, Emily." And then turned to the customer and said, "Yeah, ever since Nordstrom opened up next door, they make us do this." So that's, when we talk about relationship-centered dentistry, as absurd as it sounds, we see practices where there are scripts in place that don't come from an authentic place, and the patient knows that right away.
And when we go,
Yeah.
Adrian, when we go through and we do surveys of patients, really the most important thing that they tell us, because they wouldn't say, this is a relationship-centered dental practice, but what they would say is, they take time with me. They really listen. I really feel heard. I know they care about me. Those are the things that they say. That's when they notice the difference. Those are the things they can measure. They can't measure whether or not the margins are smooth on a crown. They don't know what an effective root canal therapy is. They don't know, they can't measure that. But what they can measure is that people have stopped and they really care enough to know what's going on in their life and how dentistry plays a part in that life.
Yeah, that's great. Linda, I think it'd be nice if you'd talk about this next point, co-discovery. For those of you who don't know Linda on this webinar, Linda is the producer of a video called The Missing Piece, and in fact, at the end of this webinar, there's an opportunity, if you're interested in finding out more about it, and possibly even consider getting it for your office. It's a great video on co-discovery where you really get to understand this. But why don't you just take a few minutes, Linda, and talk about what co-discovery means to you.
Well, if I were to define it, I would say that it is a process where I get to learn about you, you get to learn about me, and we learn about each other at the same time. So as I'm listening to a patient and I'm listening to their story, there's a way that their story affects me, and I'm learning about myself as I listen to that story. But as the patient shares their story, there's a way we think that they've shared this story with every dentist that they've ever known. And the reality is we almost never get an opportunity to share about ourselves and what we want, or what our hopes and dreams and beliefs and attitudes are. So in giving people the opportunity to do that and put voice to the story that's been deep within them, they get to start to understand themselves different. That's when Adrian was talking about this 27-year-old man that came into our conference room and joined our meeting for a half an hour. He really just did it out of the goodness of his heart. He didn't really know exactly what we were going to ask him. And as we started to ask him questions about himself, he really stopped. And he said, you know, I'm telling you this, you know, that I had silver fillings as a young boy. It was the treatment my parents opted for because it was cheaper than the white fillings. And as I got older, I opted to do the white fillings because, well, I hate to say this, but I'm a little vain. And he was almost embarrassed to say that aesthetics were important to him. And then he went on to talk about long-term treatment for himself and how he didn't want his mouth to be like his grandfather's mouth, and he didn't want his teeth floating in a jar. And there was a way as he shared the story, this co-discovery process took shape, and he learned so much about himself to the point where in a very, I mean, we talked to him for about a half an hour. At the end, he had created a treatment plan for himself.
Yeah, and how he was going to do it.
Right.
How he was going to one at a time replace those composites and amalgams with inlays and onlays.
Right.
Because they were
so
both.
The process of co-discovery really is about helping people to share their story in a way that they can learn about themselves, we can learn about themselves, and we learn about ourselves too. That there's a sharing of information that's very powerful. And of course, we could talk about this for a very long time. The video series is 3 hours, and it is real life patients, real life interactions where we can narrate and show you what happens through the process. It's, you know, very powerful.
And through that co-discovery, as Linda just alluded to, one of the things that happens is we uncover information about patients. And this is interesting because sometimes people will say to me, yeah, but I already know, or I already guessed, or whatever. Well, sometimes we're right and sometimes we're wrong, but also the level of information and the type of information that we gain in this co-discovery process is amazing. But more important, the patient starts to discover. The gentleman we're talking about, his first name is Chris. Chris was learning about himself. You could see the wheels turning. As he was talking, he was figuring out what he cared about. It's a little bit like if you go out with a friend and you sit with that friend and maybe you tell them everything that's on your mind and they don't really give you any advice. And then at the end of it, you kind of look at them and say, good, thanks for listening. I sort of know what I'm going to do now. What happened? It wasn't that person gaining information from you and telling you what to do. It was the act of talking about it and thinking about it helps you make your decisions, get your values clear, get your beliefs clear. So it's a very, very powerful tool, and this discussion here today doesn't really do it justice because there's a lot, it's so incredibly powerful. But once we have taken the time and then listened and done that authentically and explored with the patient and uncovered where they're coming from, it's at that point we can start to convey information to the patient, information about what's going to be in their best interest based on what they've told us. The meaning of that hygiene appointment starts to become very clear to the patient. Not only that, they've been communicating with someone that cares about them in the way that a best friend cares about them. And not only do they want to come to their appointment because they want to do the right thing for their health, they want to come to their appointment because they want that connection and relationship. And I'd like to sort of comment here, relationship isn't always nicey-nice. You know, there's times in relationship with patients where we have to really be, you know, challenge them, say things to them maybe that they don't want to hear. I think one of my favorite stories, Linda, would you share the story that you told me once is when you were a hygienist with your patient that used to come in late?
Yeah, great story. So this fellow used to come in late for his appointments pretty consistently, and the story we all told ourselves was that he was a really busy man, and he had a big company in our town, and he was just very busy. So it made sense to us that he just couldn't get his head around being on time. And I was challenged by someone to ask him, instead of telling myself a story, to really ask him if that was true. And so I sat with him in the reception area, no one else was around, and I said, so Bob, you know, I just have a sense that something's happening because you're always just about a half an hour late for your hygiene appointment. And he started to laugh, and he said, well, if I'm a half an hour late, you don't have time to teach me how to floss. And it blew me away because that had nothing to do with the story that I told myself.
Right.
And we got to start again. I got to ask him questions about what that was like and how he felt. And here he was, this powerful businessman being told by a, whatever I was in my 20s, you know, telling him how to care for his mouth. And he really wasn't engaged at that point in the process. So we had to redevelop our relationship and what it would be like. And after that, he was never late for his appointment.
And think about what would normally happen in a practice. Normally, we would be irritated with that person for being late. Somebody at the front desk might roll their eyes. Somebody might, the hygienist might walk in and be a little defensive and say, you know, I can't really clean your teeth in a half an hour, but we'll do the best we can. And there'd be this whole interaction. And the real story for what the meaning of that patient's behavior would never get uncovered. Now, I want to tell you, you would be stunned at the number of things that we find out from patients in this process. Yes, patients care about money. Yes, patients care about insurance. Yes, patients have things going on in their lives, but oftentimes there's much more going on than we ever knew. So I'll give you one quick example. This is a personal friend recently who told me how they had gone to a dentist who they really liked, and when they were leaving, the office suggested that they bring in their 1-year-old or 1.5-year-old at the next cleaning, just so that the kid would get used to coming to the dentist, not that they were going to really do anything. So he went to the dentist. They were very nice and very sweet, and it was all wonderful. And then he got home, and a week later he got a bill. He got a bill for approximately $100 for his cleaning, and he got a bill for his baby for about $100 who they really hadn't done anything with. And of course he was really pretty upset about it. But here's the important part. He had a few crowns in his mouth, and prior to that he was going to do them, but then all of a sudden he decided not to. And I said, well, what are you going to do? I said, are you going to pay the bill? He said, of course not. And I said, do you realize that, it could have been a mistake, anything could have happened? And he said, yeah, it could have been whatever. I said, what are you going to do? He says, I'm going to switch dentists. Now, if you're the next dentist and you get my friend as a patient and he comes through the door with that experience, if you don't learn that experience, if you do not find out, and believe me, the vast majority of patients have some story that's either happened to them or one of their friends. If you don't uncover that story and create a relationship with that patient, he's going to say to you, I don't want to do it. Let me think about it. I only want to do what my insurance covers. And there'll be some truth to all of those statements, but the real issue is going to be that he doesn't trust at this point. And if you don't get to that real issue, the possibility of him valuing his appointments and the work that he probably really needs is seriously jeopardized. So this is pretty close. We have a few minutes, but we're getting ready to conclude our webinar with you today. If you have any last-minute questions, thoughts, comments, please feel free to bring those in now. You have your chat box on the bottom. I will give you a little bit of information about some of the things that we do, some of the things that we make available at Wilkins Honda Mello. And by the way, Rati Honda is one of our partners. She wasn't able to be on the webinar with us today, but she's a person who's actually living this and creating extraordinary results. Our next one-day event for relationship-centered dentistry, and what that really is about, is a one-day workshop where you really learn the power of what we're talking about, and you walk away with some of the tools that you can actually bring back to your practice. It's good for dentists and team members. The next one we're running is on September 21st at the 90 Hotel in Boston. We also have an 18-month immersion program where we meet 10 times over 18 months, 2 days at a time, and we really change behaviors. This is where we do the work from the inside out. Very, very powerful. As I mentioned earlier, if you're interested in learning more about code discovery, I can't recommend more highly Linda's video. It's normally $375 and it's currently $295. For any of these things, feel free to go to our website at www.whmdentalconsultants.com. We have phone numbers, email access, and all of that. And I just wanted to say thank you. This has been a lot of fun for me. I hope it was informative for you, and I hope you can at least, it gives you something to think about as the next time you see a cancellation in your hygiene schedule. Linda?
Thank you. Thanks for being with us. It was really exciting to see such an amazing turnout, and that everyone stayed online for the entire webinar, and we will post more. We have lots of information and gifts to share. Thanks for being with us.
Thanks. Bye.